First, I would introduce myself by shaking the hands of the patient and family members and inform them on my position and name. Then I would explain the operation to the patient and or family members. I would make sure to fully explain the procedure in detail so they know exactly what is going to happen. Mohs surgery is a specialized technique which is specific for people who are affected by skin cancer. This procedure removes the skin cancer by removing as little normal healthy skin cells as possible. I would tell my patients that the tumor on their face is malignant. With saying this terminology, I would explain exactly what that means. This surgery is most commonly performed for patients affected by specifically basal cell carcinomas and squamous cell carcinomas. The surgery is also known with the lowest rate of reoccurrence for this cancer. Since the cancer is on her zygomatic cheekbone, it is most preferential for the scar tissue to be as minimal as possible. I would inform the patient that in these surgeries, scarring might occur and is part of the risk associated with this surgery. However, I would encourage the patient by informing them that many patients tend to see positive recovery with minimal scar tissue over the course of the initial weeks or post-surgery. I would also explain to the patient that the dermatologist would perform this procedure, and I would also explain to the patient how experienced their dermatologist is. In this way, the patient will know exactly what they are getting themselves into. I want my patients to be familiar with everything and be comfortable with who they are working with. I will also inform the patients on how long the surgery might take. The patient will be under local anesthesia. I will explain exactly what that is to the patient and also make sure they are okay with it. I will explain that the dermatologist will remove the histiocytes and scalpel with a scalpel, which is used to make an incision. Then I would explain that the dermatologist would look at the tissue and also look at the skin beneath the removal to see if there is any more malignant cancerous tissue. I will also reassure them that the dermatologist will make sure the cancer is fully removed from the patient. After the procedure is done, I will schedule a follow-up with the patient. I will let the patient know that in this follow-up, it is to remove the stitches. I will also allow the patient to pick a convenient time so that she is comfortable with the next visit as well.